All right. Well, thank you. Thank you again for coming tonight. And I know there's a lot of people been pinging me just this afternoon. Some conflict might have come up, something happened, but for those that are here, kudos. We're going to proceed. And Dr. Daner, I'm going to kick it off by just saying my business partner, a brother that I met months ago through some good friends that are on this call, James Smith and Stanley Campbell, introduced me to Dr. Omar Daner. As I said before, many of you may not have heard, he's one of the top physicians that I know in all my travels in 40-something years. And there's some unique reasons why he comes with that kind of introduction. But I'm going to let him give you a little insight on himself. But for me, for those that don't know me on this call, I think most do, but I'm just going to give you, I see some folks from Asia that's chiming in. And so I've been a banker for most of my career, went to Boston University. I studied cardiopulmonary technology major at Sargent College at BU, and my wife, Terri, 40 years of marriage. We have 4 lovely boys that many of you know and have been uncles to. And, we really appreciate that. But at the bottom of this, with that scientific knowledge that I put on hold and went into banking and did mergers and acquisitions, initial public offerings, raising capital for public companies outside of Wall Street, did a lot of interesting things and it paid the bills and it was great. But while at Wells Fargo, or prior to Wells Fargo, Terri and I was introduced to a company through a good friend of ours who worked at Channel 5 in Boston and then went on to work for CNN. And her husband was the head of CNN operations in New York. And they introduced us and said, you got to check this out. And Terri and I said, okay, let's get on a plane and go spend our money and figure it out. So that's what we did. And that has been a turning point in our lives. And then we've taken Dr. Daner out there and Dr. Al Garvin, who's a nuclear cardiologist, who's not on the call tonight. He's in Modesto, California. He normally is on this call, but he just texted me this afternoon that he has a conflict. We both went out there with Kukua from Ghana and visited with some top scientists and the top leaders of the company just several months ago. That was Dr. Daner's first time there. So with that, I fell into the wellness business and people looking at me, hey, Dave Dixon, you were the banker. Yeah, I still, yes, I was, but I left in 2020. And Terri and I now have ramped up our business because we're on a crusade. This is not just a one-time thing that we're doing. We've done a number of seminars. For those that were on those seminars will know that we have been on and trying to educate. That's what we do. We're trying to share. And as we share, we hope we will touch a lot of people like you and many others that aren't on this call tonight. And I hope that you don't become selfish with information and share with people when you get good quality information. If you like it, share it with others and invite them next time. So with all the banking stuff put aside, really focus on improving people's lives. That's what we're doing. Dr. Daner will tell you in his own words why he's no longer necessarily in doing surgery at this time. He was the chief surgeon at Grady Hospital in Atlanta. He took a tree trunk out of a woman that's still living in Atlanta. When one morning they called him at 6 a.m. and he comes into the operating room, he took a tree limb out of this woman's stomach. Nothing in the medical book he had that morning to help him through this. And all his colleagues was looking to him for advice. And he did it. This woman is walking around Atlanta to this day. And so he has a different perspective on medicine that I really enjoy, Terri and I. And that's why I give him such a large introduction, but I think I'm going to let him share with you. So Omar, Dr. Daner, as I call him, go ahead, my brother. I'm going to share the screen.
All right, awesome. And good evening, everybody. And, thank you, Dave. Thank you, Terri. Again, it's been a pleasure kind of getting to know you guys and develop the relationship. But as he said, my name is Omar Daner. I think a lot of you guys I've met before. To those of you who I have not, let me see here. I'm going to open this up and Are you, Dave, are you sharing the screen? Are you sharing the presentation or just?
You're muted,
Dave,
Dave.
Dave, can you, let me run the,
We do see the screen, Dr. Danner.
yeah, but I'm trying to get Dave to relinquish it so I can put up the presentation from my end or go to the beginning of the presentation.
Oh, maybe he's frozen.
Okay.
Oh,
can you
there
hear
it
me?
is.
So Dave, hit just, if you can hit, like, give me the ability to control the screen.
Yep,
but-
we'll get there. Hold on a second. Yeah.
So while he's doing this, again, my name is Omar Danner. I am a surgeon by training, but I did my original education at the University of Alabama in microbiology and graduated with honors, and then went to medical school at the University of Alabama School of Medicine, where I did general surgery. After I left there, I went to Baltimore and I completed my fellowship training in at Johns Hopkins in advanced critical care medicine, and then trauma, and then went on staff there as a trauma attending and surgical intensivist or critical care specialist. After staying on staff in Baltimore, I went on to Pittsburgh and did a subsequent fellowship in advanced laparoscopic surgery with a concentration in bariatric and foregut surgery. And afterwards, I went to Charlotte for a period of about 4 years, took myself out of circulation to go and study comprehensive weight management, nutrition, and behavior modification or lifestyle modification to help people learn how to manage their health in a holistic manner. But with the combination of critical care and bariatric surgery, I developed a deeper understanding of how the body works at a subcellular level and start realizing a lot of these chronic diseases that we are faced with are actually improvable, sometimes reversible with the appropriate medical guidance, and actually nutrition more so than traditional medicine. So that, it's going to take me on a slightly different journey. But the last decade, I've been on faculty at the Morehouse School of Medicine and climbed the academic ranks to professor of surgery at Grady Memorial Hospital, chief of surgery. I was the director of trauma for the Morehouse School of Medicine, president of the faculty assembly. And at the same time, ran a youth mentoring, basically a youth mentoring program called Reach One, Each One, which is a hospital-based youth mentoring and medical exposure program for high school students, where we've counseled and coached and mentored over 250 high school students on the path to medical school and healthcare careers. So, like Dave said, we met on a webinar with Stanley and James and some of the other guys, but talking about COVID and talking about health and wellness in general and how to kind of survive a pandemic. And since then, kind of cultivated a great relationship with him and Terry, except I haven't had a chance to teach him how to actually navigate this PowerPoint. And so I'm gonna have to do that next. So I'm going to pause for a second.
I gave you the steering wheel, brother, to drive. So
you have to
drive.
So for a second, you got to actually hit stop share in order for me to be able to share on this end. So hit stop share.
Gotcha.
All right, good. Now, all right, good. So I'm gonna do it on my end. And let me see what this is. So, all right, cool. And then let me do this.
Here you go. I can see your screen now.
All right, excellent. And then, all right, we do this and stop this subtitle business. And so we're going to get started, and we're going to move along because we want to make this interactive. September was Prostate Cancer Month, and this month is Breast Cancer Month. So we want to basically, give homage to, those who may be affected and afflicted, but also give people time to kind of talk and ask questions. So, again, without any more introductions, we're going to talk about the prostate. We want you to understand what the function of the prostate gland is, and then talk about prostate cancer and prostate health and screening, because we know that this is a problem that affects men around the world of all races. It really doesn't discriminate. Sometimes, again, we look at disparities, Black males tend to have a worse outcome. Some of it's due to delayed diagnosis. Some of it is due to delayed intervention. So knowing the warning signs and understanding it, and then also understanding that there are other things that can be done between, diagnosis or between annual health and wellness visits. And then we want to let some of the people on here share their testimonial, taking this more of a health focused wellness journey. And then we're going to get some summary and takeaway points. But just in general, the prostate gland is about 15 milliliters of 15 cc's. So if you take a little medicine cup, that's 30 cc's. So it's really kind of small. So half of a medicine cup. When it becomes enlarged, it becomes the size of that medicine cup or maybe a little bit larger, and they can continue to increase in size. The prostate gland sits right below the urethra in a male. Females do not technically have a true prostate gland. They're called other things, but these glandular tissues make the fluid that goes in semen to make it liquid and flow smoothly. So it's an important organ, important for male sexual function and things like that. So, again, not just an arbitrary gland. This gland, as we say, it basically sits, right in this area, and it looks like a little kind of nut in this little tissue right here. But basically, it sits behind the pubic bone and below the bladder and right, near the prostate. So when this swells, it can compress urinary flow. And this right here is why people who have enlarged prostates tend to start having urinary type symptoms as a first and early manifestation. So kind of bringing attention to prostate health through education is why we're here. And what we want to do is inspire everybody to learn more about it, to follow up with their doctor and, start getting screened, because as I said earlier, September is prostate cancer month. So it's important that we understand that the earlier detection, the better chance that we can, as medical providers, urologists and people like that, do something meaningful to give people the best outcome. So what are some potential risks? As men get older, there's a tendency for the prostate gland to be enlarged. Nothing too out of the abnormal, but this can lead to urinary obstruction, as I talked about earlier, urinary flow irregularity. Some people call it dribbling or dripping. It can also block the flow and cause stasis of urine, and this can cause urinary tract infections. But all these things combined with this abnormality of the prostate tissue, this can increase the prostate cancer risk. So the first step is seeing your doctor, getting an annual exam, getting a digital rectal exam. Some people wonder, hey, is it necessary? It's the combination of the history, the physical exam, and the laboratory evaluation that gives us the best ability to make the right assessment. What we want you to do is just understand in general the ranges for this prostate specific antigen. Other proteins, other organs can make antigen similar to this, but if it's elevated, it mostly comes from the prostate. So, it's pretty reliable. Others are negligible. The general range for a normal person is somewhere between 0 and 2.5. It's considered what's normal or safe. Between 2.6 and 4 is considered to be elevated, still not pathologic, but it's concerning. And so if it's 4 to 10, there's a potential that something else is going on. So as a doctor, what we truly follow is the trend and not the actual absolute number. But when we see that trend going in the wrong direction, it tells us that we need to evaluate people further. So these numbers go up gradually. And so somebody may have it years ago and never get any follow-up. And therefore the numbers get exceedingly high. And then by the time they get to medical attention, something, more significant is going on, which requires more in-depth intervention. And so the take home message is know your numbers, get annual screening. And the real question is, is there a role for lifestyle change, proper nutrition, and supplementation? And the answer is yes. I started kind of really studying this and understanding how cells turn over. If you give it the right substrate, it's going to rebuild better than if you give it the wrong substrate. So eating a poor quality, unbalanced, or imbalanced diet leads to a lot of health problems because the cells are using whatever it needs to not only to rebuild, but also to get rid of abnormal cells. And this all is a process. And we'll talk a little bit more about this a little later. But that being said, just a quick,
Dr.
yes.
Can I jump in real quick? So for the brothers, for everybody on the call, the exam, I've had the exam, it's a physical exam, and basically the doctor gets his or her glove and use some, gel on the glove, maybe Vaseline or something. They use it for the rectal, it's a rectal test, takes a matter of seconds. They just put it in your anus and basically they can feel that prostate may be enlarged. And so your doctor will do that first test, and then you need to do a blood test first before you stimulate that prostate. So if you really want to get a true PSA reading, never let them do a physical exam on you before they take your blood. You want the blood the minute you walk in, get that blood test, and then you take the physical test. Dr. Daner, I just wanted to throw that in.
No, that's awesome. So what we're going to do is kind of give a quick overview of prostate cancer and then discuss and explain some of this that Dave started talking about. So let me make sure this distraction goes away, but basically we're going to review the rationale for prostate screening. We're going to discuss the implications of the United States Task Force for prostate screening, and then look at their recommendations. We're going to explain the current recommendations and options to improve the screening. And last, we're going to describe a proposed algorithm or pathway that we can follow for appropriate screening for prostate cancer. So the United States Preventative Services Task Force met, several years ago, and they made some general recommendations. These are general, and then what we're going to do is talk about some that are more specific to people as Black males, because they're, based on risk, sometimes we shift them up a little higher. But what they generally said that above 75, a person doesn't really need PSA screening. However, if somebody is really viable and have, good vitality, that recommendation varies and is really dependent on the primary care doctor and the urologist. So you have to kind of put that in context. Sometimes, around this age, people start slowing down and only have maybe a limited expectation, to live, and therefore, screening for a disease that most people can live the same period with of about 7 to 10 years may not be necessary. In October 2011, they drafted recommendations against screening in all asymptomatic men. This wasn't uniformly embraced by the Society of Urology or the American Urologic Association and other organizations as well. So there was some controversy around there. So in May 2012, the final recommendations of a grade D with ABCDE, ABCDEF or ABCDF as this grading scale for PSA screening in all asymptomatic men was actually made. So it's not a lot of strong evidence, but there's some. It's a tool. It isn't a catch-all. A high PSA does not mean you have cancer, but it's something that says that person may need to be evaluated more than somebody who has a normal PSA. So what's the issue? Well, screening, there's harms of screening sometimes outweigh the benefits. So these invasive procedures to evaluate sometimes cause problems, whereas, again, the elevation doesn't really have a significant correlation with cancer. So we have to balance this information against other physical findings in history, family history, and things like that. So the American Urologic Association in 2013 came with their own guidelines for early detection of prostate cancer. And what they generally recommend is no PSA screening in men under 40. In Black men, because the risk of prostate cancer is slightly higher, we have to consider history and race as well. So no routine screening of men 40 to 54, but if somebody's African-American or comes from a family history of prostate cancer, then we recommend earlier screenings, via digital rectal exams as well as PSA. Men 55 to 69 have the greatest benefit from screening. So there's a shared decision-making based on the patient's values and preferences, as well as the primary care recommendations. And we can increase screening intervals to every 2 years in a low-risk individual, but usually every year in somebody who's considered to be high risk or higher risk. And then lastly, they recommended no routine screening for men greater than 70 or any man with less than a 10 to 15 year life expectancy. So that means that, if you have a long life expectancy, I'm gonna live the next 20, 50 years, I got me a new wife, then this doesn't apply to you. So you have to consider population-based baselines and age-adjusted life expectancy before you make recommendations. And there's no one size fits all. So this is important. And so we have to adjust according to people's status and patients' comorbidities or other diseases and conditions. The American Cancer Society guidelines for prostate cancer early detection also emphasize that it's important to discuss the risk and uncertainties of screening to promote what's called informed consent and informed decision-making. There is a chance that cancer will be diagnosed, but that likelihood, can be low. So we don't know which low-risk cancers will progress and pose a threat to a patient's health. So we have to screen everybody trying to find, apple, orange, banana, and try and take that banana out because the apple and orange is actually, okay. So the diagnosis, once you have that, could compel the patient to undergo treatment, a variety of treatments that could ultimately be even unnecessary if it's a very low-grade lesion or if it's a misdiagnosis. So we try to avoid that. You don't want to over-operate or over-intervene because anytime you do a surgical intervention or take a medication, they can be associated with complications. There's no such thing as a benign surgery or benign medication. There's no surgical procedure that's without any, quote, potential risk of harm. And so the treatments come with significant risk to quality of life. Like we talked about earlier, urinary incontinence. You can have urinary or bowel symptoms and potential injury. You can have a worsening of erectile function. Some of the principles for screening, are important. So who's right when it comes to screening? If the disease in general, if you're screening, whether it's breast cancer or prostate, has to have a high incidence. Breast cancer, prostate cancer, lung cancer have high incidence of cancers in America and Western society. So they're important that we screen for them early. The biological behavior of this malignancy and the natural history of the disease should be known. So if this is going to be an indolent cancer or indolent tumor that's not going to cause you any problem, there's not a reason to waste a lot of medical resources on it. But you should test for high sensitivity, high specificity. That means that if it's negative, there's a good chance that it's negative, and then positive predictive value. And if the sensitivity is good, the specificity is good, and it has a high positive predictive value, then that's a useful test.
I'm sorry, I have a question.
When you speak of the sensitivity, do people know what you're talking about what the sensitivity is?
And so, okay, that's a great question. And so, what the sensitivity is if you get a test and that test comes back positive, so there's 100 people that got tested, and out of these 100 tests, out of these 100 tests, you had 95 that came back positive. That's the sensitivity of the test. The positive predictive value out of those 95 positive tests, how many actually correlated with cancer. And so that's the positive predictive value. So out of 95, only 5% actually correlated. So it's high sensitivity, but a low positive predictive value, meaning that, a lot of people are positive, but that didn't really mean anything. Specificity on the other side, you had 100 negative tests. And out of those 100 negative tests, actually 10 people had cancer or had a diagnosis of something. So the negative predictive value is about 90%, but The specificity being is negative in disease. So you got it, this test should come back negative. So the higher the specificity, the better the test. But you want a test that's very sensitive and then also very specific. And most tests have some defect or imperfection. And so you have to understand that. So just because your PSA is elevated long and short, that doesn't mean that you actually have cancer. And you have to understand that. So a lot of people get it, they get worried and concerned. You know, my brother-in-law is on, Richard, and we can talk about this a little later, but his numbers came back a little elevated. So everything has to be evaluated. But the bottom line is this should be a trigger to get more information. And this is the point behind it more than
So
anything.
Dr. Dana, the other point, and Bill, the false positives, there are times, even with the coronavirus testing, there are times that a person might test positive, but they're really not, because the test is not 100% accurate. And I think the general rule of thumb is that, okay, I took a test and it was positive. Let me go back and get another one and see if it's positive, because, you know, man-made tests, they're not all that 100% accurate.
And so
Sorry,
sometimes those confirmatory tests.
Bob has a question. Bob.
Hey,
Go
Bob,
ahead.
I'm sorry,
Bobby?
I have a question. Could you go back a couple of slides?
Flip the carry around left
That
end,
one right
while he
there?
forced out of bounds at the 36-yard line.
I'm sorry. So my question is, it seems like the implication here is that testing can be negative or bad. I don't understand that. I mean, so what are the risks that you're implying that may be bad in terms of testing?
So basically, if you test with high frequency unnecessarily, you may get some false positives, and then you do interventions to basically evaluate it that cause harm. Or you may have to do a confirmatory test that adds cost when basically it was low risk and the test shouldn't have been done. So now it's called chasing your tail or chasing a rat or a rabbit into a rabbit hole.
Gotcha. Thank you.
We will have a Q&A session at the end. So if you have a question, let's hold most of them until the Q&A segment. All right.
I think, you know, Dave, I think it's difficult to hold questions. It sounds like there are some people who have some concerns and there are some people who have some experiences. You know, that's why I asked the question about the
Oh, no.
specificity.
Yeah. That's fine. That's fine, Bill. You and Bobby, that's okay. But I'm just saying, you know, for the bulk of the questions, we can do it in there. But if you feel the need to jump in, feel free to do so.
Well, okay, so I'm going to jump in. So
My philosophy is this is for you guys, so just feel free. This is a free open forum for you, okay?
So yeah, I'll give you an example. So I'm a prostate cancer survivor, and I've had 10 close friends that went to the same high school that have had the same problem. I'll give you an example about what he was talking about in terms of a false positive. I have a relative who's had what you call chasing his tail. He's had 3 prostate exams, and then he's had the biopsies done, and which was, you know, 12 staples. They take out the samples, and all of them each time came back negative. Well, the question was of me having. He said, "What's going on?" And I said, "Well, you could have high numbers and not have prostate cancer at all." Again, you talked about people 72, 68 and over. You know, I have a gentleman who's 68 and over. He's in his 70s right now. One of the most interesting things is he's taking hormones. Every other year, he goes on hormones, all right, to slow down the process. But like you said, at a certain age, based upon, you know, your life expectancy and longevity, they're not going to recommend a very invasive procedure. Okay, my procedure was invasive because out of 12 samples, 4 came back and the numbers were 4.5, but I had an enlarged prostate and the prostate cancer was prevalent. So I had it removed, and I used the, not the cyber knife, but the laser. They did it with that. But I will say this here, you know, in support of what the doctor is saying, is that it's, you know, the exam, you brothers might think is invasive. It's not invasive. It's just it's what it is. And in the end, you know, I'm a prostate survivor. You know, I will go on record and say that, no, I don't get erections. I know there's some females on there. I know one that I know personally, but I don't get erections. I've tried Viagra, all of the pills, but I've tried the shot with Dr. Lazarus here in Massachusetts. And, you know, the shot worked 3 times with the chemical process that was mixed. But after that, each bottle was like $160, and the first shot worked, the rest didn't. So, I mean, I'll leave it at that. I'm not an authority on prostate cancer, but I am very informative in terms of what I do know about it and having the experience and having to go through it.
Okay,
That's
thanks,
awesome.
Bill. There are a bunch of other people that are on tonight that have some stuff to share. So we'll get to that after the presentation, but thanks, Bill. Go ahead.
That's awesome. And so, you know, again, just kind of just doing this, and like you make a lot of great points, but the bottom line is whatever the screening should be acceptable, it should be effective. And this should lead to effective treatment of disease. But the question is, should screening lure the disease-specific sickness and increase survival? And the answer is yes, and that's why we do it, because if we could detect it and intervene, then we can do something like Bill was just talking about. So the bottom line, looking at the evidence, we want you to understand the PSA. That is not a catch-all, be-all, but it's part of an overall process. The prostate cancer incidence and mortality over time, we will talk about that a little bit, and then a few, you know, randomized controlled trials. We won't get into that too much at all. So what we want to do is just talk about, you know, when was this discovered? The PSA, they start using it about 1970. It's the most widely used oncologic biomarker, and 3 out of 4 men over 50 have had a PSA measure. So it's a very common test. And so the prostate gland, basically the PSA is produced by the glandular tissue of the prostate gland. When it gets enlarged, when it gets infected, when it gets traumatized, when it gets cancer or something pushing on it, this protein leaks out and can be detected in the bloodstream. So, but remember I said earlier, this is produced by other glandular tissues, the salivary glands, which make saliva or spit, the pancreatic tissue and breast tissue can also make it in low amounts. And so in case you get a rare tumor that actually may produce this antigen in the bloodstream. So we have to look for other causes. And just because it's elevated, it doesn't mean there's something wrong with the prostate. That's the take-home message. But it's found, the prostate fluid is found in semen, it's found in urine, it's found in blood. And this antigen, it actually breaks down semen to improve the sperm's ability to move. So it's found in 3 different forms, but the one that we really look at mostly is the free PSA level. But as we said earlier, it's not a perfect test. There's a poor sensitivity, here are the numbers, about 35 to 70%, meaning that if you took 100 people that had a PSA elevation, the test would be accurate in 50 to 70%, 35 to 70% of them. If it was negative and somebody didn't have it, about 60 to 90%. So there's 10% or 10 to 40% false negativity with this test. But the sensitivity of the biopsy in screened patients is 60 to 80%. So you can improve on it by taking what Bill said, measure the PSA, and then doing these biopsies, which we'll talk about a little later, in the form of Gleason scoring, and help us to understand that. But the traditional PSA cutoff of 4 is no longer an absolute indication for a biopsy. So if you're 1 and now it's 1 point, so it's 1.1 and now it's 2.2, and next year it's 3.3 and 3.7, we look at that trend, and that trend suggests that there's something going on that we need to evaluate. Other factors that I talked about that addresses the PSA include infection or some kind of inflammation, instrumentation, recent urinary retention, or if people have ejaculation or vigorous massage, or, as we talked about at the beginning, advanced stage or benign prostatic hypertrophy or enlargement. So when all those things can occur, the point is that there are other things besides prostate cancer that can cause elevation. the reason we say this is to reduce your anxiety associated with getting the test, or you get a number that's abnormal or a little bit elevated. You know, hey, this isn't the end of the world, so don't shy away, follow up efficiently. If it is elevated and your doctor sends you to a urologist, they recommend doing biopsies. We want you to understand what these biopsies mean. There's something called Gleason scoring. I think Bill was talking about his numbers and 4s or 3.7s or 4.7s or 6 and things like that. But sometimes, you know, when the numbers, you get these biopsies and look at it, you can't get any definitive tissue diagnosis, so the Gleason score can't be determined. But if it's 1, then that's okay. If it's 2 to 3, it's abnormal. When it starts going above 3, like when we start getting 4, 5, 6, that's a suggestion that there's some abnormal prostate tissue there. And up to 6, the tumor tissue tends to be well differentiated, less aggressive, and likely to grow more slowly. And so this is a good time to intervene. This still represents, you know, potentially malignant lesion, or there's something called malignant transformation. That means this precancerous tissue now goes through a metamorphosis or change and now progresses on to cancer. So that's why sometimes people are doing what's called surveillance, following you along, and the tissue is abnormal, but is not cancer. So they have to get follow-up subsequent biopsies and screening to make sure there's no deterioration or malignant cancer. Or malignancy and cancer mean the same thing, transformation or transition. When it's above 6, the tumor tissue is 7 is considered to be moderately differentiated. It's more aggressive and is likely to grow, but it may not spread out of its local area. When you start getting Gleason scores of 8, you have a lot of kind of nuclear activity suggesting that this is a poorly differentiated tumor or undifferentiated, which is bad. These tend to be highly aggressive. They're likely to grow fast and spread outside of this. Black men have higher grades of tumor, whether it's from delaying, whether it's from genetics, whether it's due to diet. We don't 100% know, but they tend to have a more aggressive tumor, probably because we wait, and therefore we recommend early screening at 40 so we can catch it in the early stages at 6 or less versus getting these 7, 8, 9, 10s and above. And so, you know, that being said, to put this in perspective, prostate cancer is the 3rd most prevalent cancer behind breast cancer in females and lung cancer in the general population. However, when you look at prostate deaths, cancer deaths, prostate cancer is actually the 4th leading cause of death behind lung cancer, which is the most common cause, and then followed by colorectal cancer, and then breast cancer, and then prostate. So basically in men, it's the 3rd leading cause of cancer death. And again, women don't have it, so it doesn't really apply. But prostate cancer represents 13.3% of all new cancers diagnosed in the United States, which is a significant, number. So in summary, the question is to screen or not to screen. So get screened, get a digital rectal exam, do your annual exam, look at your whole health, and get a PSA level, and then know your numbers and follow it along. And while better treatment exists for advanced metastatic disease, there's no one has examined quality of life morbidity costs compared to early treatment. So we're not trying to get to an advanced stage to see if early intervention is better than this. We want an early detection. My mom, before I went to medical school, taught me this growing up: an ounce of prevention is worth a pound of cure. And so the question is, how do we best maintain our prostate health? And that's where I'm going to transition us over today, because, as opposed to just waiting between surveillance from year to year, what we found is that there are nutritional supplements and nutritional adjustments in diet, including exercise and fitness and decreasing BMI, that decreases all cancer risk, including prostate. Where there are some substances Dave will talk about, like saw palmetto and lycopene and tea greens that actually help to improve prostate health. So at this point, what I wanted to do is I want to just kind of transition this over to Dave. We'll take questions in between.
And
And
Happy Pizza, gold sponsors, our
Hey,
Texas Golden
hey.
Grill.
Hey, Dave, can I ask a couple of questions?
Turn off your
related
TV
to
in
what-
the background. Put your TV on mute. Smitty?
No, man, I'm out of the football stadium, man. I'm getting background. I'll let somebody else go.
All right.
Oh,
Okay, thanks, Dr. Daner. Sorry about that. I know James is on, but he's,
Platinum Group Real Estate with Jenny
yeah, James, still getting feedback. All right, thanks. So, okay, really quick, the nutritional side, as Dr. Daner he mentioned before, it's very important as a baseline. So before you start worrying about screening when you're like Max Baptista, who's on the call tonight, my nephew, right? He's young, but for the young people that are on, you need to get your diet right. Everybody needs to get their diet right. That's the first thing. And Dr. Daner and I both agree, and Terry, this is the baseline, right? Once you do that, you now have a good chance of mitigating some of the potential risks that come along. I'm not saying it's going to get rid of the possibility of somebody getting prostate cancer, but I'm saying take care of your health first. So Pharmanex, we went into the company, like I said, years ago, and we have studied with about 75 of the scientists out there that have done some phenomenal work looking at the blue zones around the world. That's how their focus has been. The blue zones like Okinawa, Japan, where people live over 100 years old, in the Mediterranean, south of France, Alaska, Peru, and other places. Now, these scientists are geneticists, there are immunologists, they're nutritionists, top level scientists, both PhDs and MDs. So the supplements that are key, and Dr. Daner will back me up on this all day long. Vitamin D3 that we get from the sun between 11 a.m. and 2 o'clock each day is pretty powerful for all of us. Let us start there first, getting your vitamin D levels in order. People of color tends to be lower. Why? The pigmentation in our skin blocks some of that sun, which is good for us because of the UV rays. But what you got to understand is this: it's not a vitamin, it's a hormone. Vitamin D is a hormone. So you need that in your body. And our vitamin D is made from mushrooms. The shiitake mushroom, you can look it up, Google it, one of the most powerful sources of vitamin D outside of getting the sunlight every day. So this is a vitamin that we have, a D3 supplement by itself in a bottle, stick it in your mouth like candy, and you're gonna eat that throughout the day, one a day, you'll be fine. Now, 500 international units, if you need to load up, Dr. Daner will tell you, most of the stuff that he's worked on and learned through medicine, the 50,000 international units is really what people need to get to if you have some really key issues going on health-wise. But for the average day-to-day, the vitamin D3 is needed in your regimen. Prostate formula, I'll show you this product. It's really key because it has been verified scientifically. This is botanical. This is not something concocted in a lab. This is good for prostate conditioning. What I mean by that is it's not a drug. It's for prostate conditioning, meaning that you want to keep that prostate as healthy as you can for as long as you can. And then there are other complementary products that we're going to touch on, like tea green, which is basically green tea that is farmed, but at a very early stage. The baby leaves, the young leaves is grounded up into a powerful antioxidant, which is also powerful for the prostate. If you go and read, you will see that this is scientific fact. Both third-party science validation has been done around the polyphenols and the power in green tea. But we just can't drink enough green tea, so you need some kind of supplementation. LifePak Nano, I'm going to cover LifePak Elements. These are the nutritional products. And then the G3 drink, which is the most powerful GAC fruit on the planet. Most people in Asia are very familiar with the GAC fruit. Look it up online, Google it. It's the most powerful fruit that the good Lord has put on the planet for us to eat. And then I'll talk about Age Lock Youth. Why don't you go to the next slide for me, Dr. Daner? Okay, so this picture is, you're going to see on the left, it's really the supplement for children. Our kids grew up, our boys grew up on that supplement, that little bottle with the giraffe on it, Jungle Malls, okay? It's formulated for children as they develop their bones, their tissues, everything in the body, very healthy, well put together, scientifically based. And then you have the product next to it is the Age Lock Youth. And then you have the G3 drink and the scanner in the picture. The reason I put this picture up here, that biophotonic scanner, which I have right next to me here, is the only machine in the world that can basically measure your carotenoids. It measures your carotenoids in the body, which are linked to antioxidants. If you've been reading and you're knowledgeable about what antioxidants are, that fight free radicals in the body that beat up our healthy cells, there is a pattern here, and this machine can measure your carotenoids and give you some indication of how well you're doing immune-wise, your immune system. So the only one in the world to measure that, it was on Dr. Oz, it's called the S3 biophotonic scanner. Terry and I have one here, and we do scan people that come by our home or go out and do it for people to at least give you a baseline and what your score is. And some of the brothers on this call have been scored, and it only takes 30 seconds. Next slide. Now, this is the prostate formula, gentlemen. It's a proprietary blend of powerful antioxidants and botanicals, providing superior prostate health. The supplement promotes normal prostate health. So you take one capsule twice a day, typically with food, okay? And then the ingredients here is selenium. Selenium is very good for the body, 100 micrograms. You also have saw palmetto, which is Serona, 160 milligrams of the repens extract. The green tea I talked about, Tea Green 97, it's also in this product, which causes the polyphenols are very good for the prostate, okay? So the green tea extract, and this again, just to be very specific, it's not your typical green tea. It's from the baby leaves, which have the greatest medicinal value, according to the scientists that Dr. Terri and I met with. That is how they get it. They grind it up. They make sure the efficacy is there, make sure it's safe for consumption by using the 6S process. If you don't know what that is, look it up. All pharmaceuticals have to use the 6S process to develop medical drugs for you to put in your body. So it's very important to know that all supplements are not the same. Get the right stuff for your body. Don't try to go to just anywhere and pick up supplements if you don't know what's behind it. Lycopene comes from tomatoes. We all know that, right? But in lycopene, it's very important for the prostate. Look at all the research that's out there. Google it, and you'll see that it's been validated by third-party scientists all over the world, in Europe and around in the United States. Lycopene is a good supplement or compound that you need for your prostate. And berries, the darker the berries, good, 85 to 95%. And then you have some fatty acids in here. So it's the best stuff I've ever seen put together and validated under the 6S process. Again, that's very important, scientifically proven, and the research is there on the website to validate this stuff. So you can check it out when you have your time, when you have some time. Next slide, Dr. Dana. Okay, Tea Green 7, that's the Tea Green I talked about earlier. Again, 2 capsules, you can double up. So if you want to do your prostate formula, you can also take the Tea Green as a separate supplement daily if you really need to get that green tea extract in your body, the polyphenols that are pretty powerful for cell protection. What is cancer? As Dr. Dana said earlier, you want to get healthy cells in your body, right? A mutated cell is cancer. We were born with healthy cells, and they replicate by the millions every day. So if you give them what they want to feed on, guess what? You want to make healthy cells. Okay, we cannot make claims from a medical perspective, although Dr. Dana is on this call, but my disclaimer will say, we're not here to treat diseases, but we're here to educate. And the green tea extract, and that's the exact compound, Camellia sensi, is high quality green tea from the source that are leaved in the potency 500 milligrams. Next. Okay, Life Pack Elements. This supplement it just came out in January 21st, 2021. Just came out. It has 20 key ingredients in it. Why is it so important? We cannot eat everything we need every day. You can tell me all you want, or Dr. Dana, or tell us all, oh, I eat a balanced meal. That's hogwash. It's not possible. You're not doing all the right things you need to do. The food you eat every day is not giving you enough of what you really need. So when I talk to the scientists and we validate this stuff, they confirm you need the minerals that are trace minerals in your body. The Krebs cycle from high school, when you talk about it, guess what? That's when you eat food and the minerals are there like zinc, magnesium, calcium. It turns into energy. You don't want to go to sleep. Vitamin C is very important to the body, and zinc, especially in this pandemic environment we're in. Zinc and vitamin C, Dr. Dana and I will confirm, very powerful for your body. This supplement has it all in there for you, 20 essential compounds that are minerals and phytonutrients. And again, it's a level 1 scanner. So when you take this product over time, you get scanned with your carotenoids, you're going to see your scores increase. Why? Because it's giving the body the things that you might be deficient in and you don't know it. So pretty powerful. Next slide. So this is about $49 for that product.
Yeah, but Dave, I just want to make one comment. And, I think that the most important comment I can make is having a healthy nutritional baseline is essential. Throughout the pandemic, we focused so much on vaccine, we forgot about the base of preventative maintenance and health optimization. The immune system is a part of one of those systems when we look at the body that can be optimized. And so, a lot of people hear these arguments about vitamin D and whether it works or not and all those other things. They all work together in concert. So you have to have adequate levels. But the important take home is that this, along with vitamin D, the vitamins and minerals working together in concert, gives you the best potency to augment your overall health, your wellness, and your immune system. And I know a lot of people have been taking and having great results by taking this more holistic approach.
Thank you, Dr. Dana. And then for the Rolls Royce of nutrition, okay, this is your nutrition. This is like eating food, but you don't eat it. You don't eat the food you're supposed to, because the triangle that the United States government put together, it shows you all the fruits and vegetables we should be eating every day. It's humanly impossible. We can't do it for your health. You cannot do it. We cannot do it. So what this company has done, Pharmanex, they put together this product. It's called LifePak Nano. LifePak Nano I have right here. And I'll show you really what it looks like. This is my box I use every day. It has these packets in it, okay? What's in here is all the vegetables and fruits that you don't like to eat, or you cannot eat enough fiber because it's boring, but it's all here, and the trace minerals. And what's here is your, these two purple looking gel caps, okay, has liquid in it. That's your omega-3 and krill oil. If you do your research, you're going to find that high level marine grade. I'm not talking about the stuff at CVS or Walgreens. I'm talking about high quality marine grade omega-3. The scientist tells us they still don't know why it's so powerful for the human body. And it does phenomenal things for your circulatory system, for your cognitive ability, for your joints. Still don't know why it's so powerful, but it is, and it's not a drug. So this is what we take daily. This is the Cadillac or the Rolls Royce of nutrition, the LifePak Nano. And then the drink, that's the G3 drink, which is the GAC fruit and Siberian pineapple. That is one of the most powerful fruits on the planet. And if you don't know what the GAC is, let's look it up, GAC. That's the name, Google it. The GAC fruit is the most powerful fruit that we have on our planet to date, based on scientific validation. Next slide, Dr. Dana. So the Age Lock Youth, I wanted to throw this in here because I'm going to share something that happened to me and Terry. When this first came out about 5 years ago, Terry got her first bottle and I didn't get mine. So I said, wow, Terry, can I try some? She said, no, yours is coming. I'm going to try mine. She had a situation with her hand. She couldn't pick up her luggage in the airport. I had to carry her bags. She couldn't pick up a washcloth in the shower. That's how light that washcloth is. It was major pain in her maybe tendons in her right arm. She took it for 2 weeks, twice a day, 2 in the morning, 2 in the evening. They had to go around the world to make this supplement called Age Lock Youth. It resets the gene expressions in humans back to a 25-year-old. So if you're my age at 65 and you want to go back to be a youthful state, this product is pretty powerful. So It also reduces inflammation naturally in the human body. It has purple corn in it because the purple corn that's grown in Peru, Google it, look it up, very powerful medicinal values for it. So I don't want to go into all the details on the 10 things that it contains, but if you see it on the screen here, look at it yourself. It's pretty powerful what it's doing for your body. So like age like youth, give you that youthful state. I took mine and I ran 5 400 meters on the track several years ago at 62 years old. And I hadn't done that in a long time since my collegiate days running Division I track and field at Boston University.
You're out of shape.
Yeah, Bill. Yeah. So it also gives you stamina. For those brothers that know, you know what I'm talking about. You want stamina. This is the product. This is just one of the products, but you also get your prostate formula, which is very important, and to take that for several months and see what it's going to do to your body. Okay. Conditioning is good. Next slide, Dr. Dana. So now, this is the end of the segment of the presentation. We thank you for your time for those that have stuck around to really check this out. There's a question out there about robotic surgery, and is that the preferred type of surgical intervention? The correlation between high LDL and prostate cancer, is that poor quality, high fat diets and all this stuff? So there's a question out here in the chat that we're going to try to dissect and maybe let Dr. Dana take a shot at.
Yeah, and so, yeah, I put it in the chat, but, for the sake of, surgery, the less destructive the tissue, the better the patient outcome, the more efficient. The robot has revolutionized prosthetic surgery because the laparoscopic approach, we use these straight, we call them chopsticks with straight laparoscopes, and they're harder to maneuver. The robot actually gives you more dexterity and flexibility and range of motion in that area, as you saw right behind the pubic bone, right above the urethra. So you can actually do a very finessed operation and remove it with less tissue trauma. So people recover faster, have less complications with male performance afterwards because you don't have to disturb those nerves. So going to somebody who has that skill set and uses that approach, I definitely think that robotic surgery has taken over and revolutionized the urologic treatment for the prostatectomy for prostate-related disease, namely prostate cancer.
Dr. Dana, what is a cyberknife surgery?
The cyber knife, these are just kind of fancy ways, but they're really like laser type surgery. But sometimes we use what's called a cautery, and we use a metal tip and we go right close, but they're actually laser beam type procedures that we can use and cut tissue with the laser, just like we see on some sci-fi movie. And so the cyber knife is we're using like the digital tech 3D, basically referencing. So we put it inside of, use a computer algorithm, and that helps to guide the operation. So it's just because it's a cyber internet-based procedure, and we use it to try and get the best configuration when we're doing it. They use that a lot in neurosurgery because you operate in very, very tight spaces. And so you're getting as much information as you can as you're doing these procedures to try to minimize additional or collateral tissue damage.
With the cyberknife surgery, you got to go through a treatment process before, whereas with the robotic surgery, you don't have to.
Well, it's because you got to put the things in place, for referencing. The computer has to bounce off of something in order to basically, triangulate. And that's kind of like military, where they hit a target, they'll triangulate off of different things. And basically all the information is feeding back to a computer. And then they're going to launch that missile or whatever projectile based on all this data. So it's more kind of a triangulation. So you put in beams and things like that to help get the information to guide the operation. But at the end of the day, all of it is to remove whatever structure or tissue that we're going after without damaging tissue that we don't want to injure.
Hey, Dr. Dana, can I ask a couple of questions? This is James Smith.
Yeah, why don't we jump right into the Q&A session? Why don't you stop sharing your screen, Dr. Dana? And for contact information, it's right there up on the screen. Dan Bar for Life is Dr. Daner's company, he's CEO. And for lovehowuage.com is Terry and our business. We'll be launching our website coming up very soon. So we will let everybody on this call know about the launch of lovehowuage.com. It's not ready just yet, but it's baking and almost ready. We'll launch it. There's a lot of powerful information out there for you. And the same at Dan Bar for Life, because it's a lot of stuff that Dr. Dana has put together from assessment perspective, obesity, a lot of things are there, valuable information that you should check. Okay, James, why don't you go ahead, stop sharing, Dr. Dana.
So, I've lost a couple of friends to prostate cancer, and the story used to be that if you got prostate cancer, they used to say that you would probably die from something else before you would die from the prostate cancer. He was a young man, he was in his 50s, he eventually passed away, but during his journey, he and I talked a whole lot. And he said that he had gotten all the regular exams, the digital exam and the PSA exams, and they actually came back relatively normal until they stopped being normal in a flash. But during the digital, they don't just measure the size of the prostate. The other thing they do, and I had one about 2 or 3 weeks ago, is they look for lesions or bumps or nodules in the prostate, around the circumference of the prostate. Dr. Dana, maybe you can confirm this, but I understand that prostate cancer in Black men manifest themselves differently. Instead of the nodules being around the circumference of the prostate, the ones where you can reach with the digital exam, it actually manifests itself at the top of the prostate, where they don't really examine. They can't really reach that high. And when you have a swollen prostate, the cancerous nodule on top of the prostate, it actually abuts against the bladder, which is exactly what happened to him, because since the nodule was on top, the cancerous nodule was on top, abutting the bladder got cancer, and it just basically ran through his whole urinary tract system up to the kidneys, where he lost his kidney, as a matter of fact, and he eventually passed away. So that's one of the questions I have about prostate cancer, especially in Black men. The other thing that I'm dealing with right now, and that you deal with as you age, is as the prostate grows, a couple of things happen. When the prostate grows, it pinches the urethra that goes through the prostate, and now you have an issue with your flow when you urinate. Okay, you have a weak flow. So the medication that they give me in that case is tamsulosin. Tamsulosin is something that's supposed to relax the prostate. You take it every day, and it basically brings the flow back to a normal kind of a level. The other thing that you deal with as you age is, as the prostate grows, again, as you age, it pushes against the bladder. And sometimes you can be walking around all day and you feel fine. You might have a little bit of inertia to go to the bathroom, and it usually is okay until you get about 2 or 3 feet from the toilet. Then things begin to happen where you got to really start clamping down and doing what you got to do to make it to the toilet so you can go ahead and have a good urination. And sometimes it gets really challenging. It always seems to happen in Home Depot when you're on the other side of the store, and you got to discreetly sort of lock everything down while you work your way to the other side of the store at Home Depot, so that you don't make a mess of yourself. But I asked a doctor about that during my last visit, and what he says is that when you get the pressure of the prostate against the bladder, it gets to a point where the bladder starts to spasm. And the spasm is makes you have that urge to have to go in, and you have to do something. It's probably psychological partially also, because again, you can go for an hour without doing it. You get about 2 feet from that toilet, and you got to go really, really bad. So, maybe you can discuss that as well. Those 3 issues: the manifestation of the prostate, of the cancer in Black men, where it manifests itself, the health of the prostate, the narrowing of it, the restricting of the urethra, and then that spasming against the bladder that causes that strong urge to go.
Let's address it kind of one at a time, but great questions. But let's just start with Black men and talk about all men, because correlation doesn't mean causation. So there are different presentations, and there may be a tendency to have in certain men the lesion more in what's called the proximal versus the distal part of the prostate. But in general, one of the issues is getting
Dr. Dana, you muted yourself.
No. I gotta unmute Dr. Dana.
I just unmuted myself again.
Yeah,
But-
sorry, Dr. Dana, there was some noise in the background. I was trying to mute everybody else.
Okay. So, again, I was saying, and I think we may have heard that just because, and again, there's different aspects of the prostate. It's in the proximal part or the distal part, the beginning or the end or the middle. That actually, there may be a little variation, but the real issue is getting people to relax, to get a thorough exam with appropriate pressure, appropriate relaxation, and a good digital rectal exam. You should be able to feel most of the prostate. The reason you need them every year is because you're correlating that previous exam to this next exam. And so, yeah, it may be, and some people develop nodules, so we look for nodularity or the smoothness as a smooth nut. But sometimes, you feel a hardness, a firmness, sometime in the middle, sometime in the distal part of it. Some people have what's called a high riding prostate, and they're a little more difficult to examine. Those people, if it's a difficult exam, you need other corollary measures or studies. So you measure the PSA in that particular person. Sometimes you may have to get a prostate, a specific test, ultrasound or something like that, if there is a clinical concern. So that's why following the trends of the exam and the PSA, and then add ancillary studies, other confirmatory tests become important. And through, kind of using history and physical exam and labs, and sometimes radiographic or sonographic studies, we get a better understanding. But the most important thing, I think, is your guys' understanding, your education and edification. So that again, helps you to be a partner in the process. And so changing the doctor-patient relationship to the doctor-patient partnership becomes key. And it's really about educating you. So it goes from a monologue to a dialogue. And these questions, same as you're asking, a question that you should be asking your doctor and talking about, so that he knows you understand. And once they find you're educated, they're going to respond to you differently, because now, they can share more information to build on the foundation that's being laid. That's number one. Number two, you ask so many questions, I forget all of your questions, James. But the second thing that I would say, as it relates to prostate health, as you get older, everybody's heard, okay, you're going to have prostate problems. But the issue is that we think about this as, okay, this is a self-fulfilling prophecy that's going to continue to evolve and get worse. What nobody ever tells you is that if you take things that improve prostate health, it gets rid of some of the swelling of the tissue, getting rid of the inflammation and the swelling of the tissue, cause that PSA number not to leak out so much, and that PSA can go down. And in addition, because you got the swelling out, you don't have the irritation that's either obstructing it or causing that feeling that you have to void. And therefore, it basically gets better, because with less swelling, less irritation, you can control your own urinary flow. So the prostate formula, I would say I've been very impressed with. I don't have any prostate problem myself, so I've used other people's reference. They'll tell their own stories, but basically going from 10 and 20 and 25 years of having problems that you just described to basically now being able to control when they go to the bathroom after running, after meetings, after preaching, after doing whatever, not getting up in the middle of the night. These kind of things actually, are actually possible and have occurred with even people who may be on the call. And the third question, James, I forget what it was exactly, so just repeat it, and then I think Bill has.
So the second one was about the narrowing of the urethra as it passes through the prostate and the inability to have a strong flow. And the third one was about the enlarged prostate pushing against the bladder, causing the spasms, which really makes that urge very strong.
Right, and that's what we call benign prostatic hypertrophy.
Right, yeah.
And then that's why I was saying that this actually, saw palmetto, is not, like Dave said some one time, it's not what you take, it's what your body absorbs. It's the quality of it, the concentration. So when you dilute things down, it doesn't have the effective amount and dose. But the important thing is that taking natural products, whether it's vitamin D or taking enough iron to make sure your red blood cell count is actually adequate, or your hemoglobin at least, or hematocrit, or taking enough saw palmetto to make the tissues around the prostate healthy is important. Poor quality knockoffs don't necessarily give you that, and it gives you the delusion or illusion that nothing works, so why do anything? It's actually fundamentally untrue. With the right substrates, the cells can reset themselves in a healthy fashion so that irritation on the bladder from the swelling can go down. But if, say, for instance, this is a reversible condition, it's just swelling and not, say, some malignant lesion, that irritation, that compression of the urethra, which is a hole inside that's coming from your bladder that basically goes out through the penis and basically that's how you get your urinary flow. When that's compressed, then it comes out as a narrower stream. You don't basically evacuate, and then you have the dribbling afterwards. And then because the bladder is incompletely empty, you have frequency, so you always feel like you got to go to the bathroom after you use the bathroom. But these things, in my experience, I've seen people improve, taking this prostate formula. We'll let them talk in a minute, but I wanted to just answer those questions. So maybe I have like Richard on, and maybe he can talk a little bit, and Marie, but he's been taking it for a little while. So that's one person. I'm sure there's other people, but Richard, maybe you could share your story for a little bit, or Marie. This is my sister-in-law. Hey, Marie. And so
Unmute yourself, Marie.
Fine.
Hey, Marie, how you doing?
unmute
Hi.
again.
Okay.
You unmuted?
Yes, I'm
Yeah.
unmuted. Good evening.
Good evening, folks. My name is Richard Portillo, and I am in process of going through a biopsy for my prostate, which just recently I discovered that my levels were up there. How much it was, 16 or something like that.
16.5.
Right, and my doctor recommended that I get a prostate rectal exam. I did that. Then I did a MRI. They discovered some lesions on my prostate, or around my prostate. And then, well, right now I'm in the process of doing I think it's Wednesday. I'm supposed to be scheduled to do a biopsy. Now this thing has had me. So, but I have been using the Life Pack. I have been using the Soapamento. One of the things I'm not too before, well, of course, trying to figure out what really causes causing me to urinate. Is it there? Is it the prostate problem that I'm having? If it is a major problem, which I guess from the exam and from the MRI, whatever that lesion, I don't really know what a lesion is because I'm not medically inclined like that. But of course I do read. So this lesion had me a bit perplexed. And then the other thing about it is that I've been kind of scared and worried about this thing because it's something new to me. I have hardly even been to the doctor in my life. Like, most of my life I've been healthy. And it has been confusing to me. Now, I have been taking the Soapamento. I have been using the Life Packs. I have been using what Dr. Dana
Prostate formula.
Yeah, the formula, and I think that there's less of a frequency to urinate like probably prior to taking it. Really and truly, there's less of a, because look, I've been sitting here and I don't want to go to. Since we started the conversation, I'm not, I don't want to go to the bathroom or anything like that. So I think I'm pretty good still. But it has been a challenge for me, I think, in my personal life, and I'm wondering what will happen to me. And I've been listening to some of the, the comments on the Zoom chat there about what happens when. One of my things about this thing is this biopsy that I'm going to be doing here. For those of you, and I'm asking the question for those of you who have gone through it, this biopsy, this is a painful thing. I know, how would it affect me at this stage? That is what I want to find.
Bill, why don't you weigh in because you've had it, Bill. Go ahead.
Brother, they take 12 samples. It's not painful. It's just like it's like a little needle, just a little more pressure. It's more pressure than anything else. The other thing you want to find out is for example, when I had my prostate and I went through everything, my prostate cancer was in what they call the pocket. So just if you take your finger
Yeah.
and you put your thumb and your trigger finger together, that would be in the pocket. So if it metastasizes itself outside of the pocket, is what your concern could be. Okay. The other brother was talking about his friend passed away. They found it on top and it went up to the bladder. That's probably because by the time they got to the prostate cancer, it had metastasized itself. And so they probably had to go in and do more surgery than what was anticipated. But the pressure from the actual biopsy, at least for me, it wasn't painful at all. There was very little discomfort. I was able to walk out of there on the way out. One of the other things is when you talk about, there's this, along with what Dave is talking about in terms of the prostate formula he's talking about, there's an exercise that they have you do, all right, which is to really suck in your gut, but around the prostate area, you know, just squeeze your buttocks together. And they like you to do that to 100 to 300 times a day so that the urine flow will not get to a point where if you on the other side of the Home Depot, like the gentleman said, you got to pack up your stuff and run all the way over to the other side. But let me tell you, when you have your prostate removed, okay, for example, me, I've had my prostate removed. I do those exercises, but one of the things is you only have one valve now. When you have a prostate, you have two valves, and you only have one valve. And when that one valve becomes full, the minute you get up out of your chair, you feel like you have to go, or you might end up starting to drip somewhat. So you got to make it this. So you got to exercise your knowledge of when you feel like you got to go, instead of sitting there wiggling and doing all of that, trying to hold on to it. You got to get up and go. Okay, when I'm at my job, I get up so often that when I get up, I know I have to go because I only have that one valve, and that one valve, I'm applying pressure on it because of the way I sit. Okay, so that's one of the issues. The other issue is that, you know, as you go through this process, all right, make sure you're going through it with a doctor who is just not rushing you through it, okay? You want to go through it with a physician who has your best interest at heart and who's not going to keep looking at his watch because he's giving you all the information you want. Because when I went through mine, you know, my doctor had already made it clear to me, we're going to set you up for the CyberKnife, and the CyberKnife meant that I was going to go and have 32 types of chemotherapy, whatever the process was. I forget off the top of my head, but I went with the robotic surgery because in the robotic surgery, they actually tried to save the vein, all right, that the blood flows through to help you get an erection, okay? And it's important that whatever medication you take, and they give you generic Viagra, all right, you take one a day so that the blood continues flowing while you're going through this, okay? So I would let you know that don't look for a lot of pain because it's not a lot of pain. It's pressure. It's like I would define it as just pressure with a little staple as they take the samples out, okay? You know,
Good.
so that would be,
without trying to cut across you, there are two types of biopsies, and one is the one to the rectum, I guess, and then one is the, what is it, Marie? Help me with the word. Perineal. Anyhow,
It's invasive. It's the invasive choice. But before Richard goes any further, I've got it. I'm good because he's concentrating on that. I am too. But with this prostate health, we managed to lower his PSA score. That's the thing that I'm extremely excited about. And I started, you know, I'm asking Richard every day, you're taking prostate health? He says yes. So it's time to reorder. So I checked the bottle, and guess what? The bottle evidently multiplied or something. I think that's what happened.
I've been taking my stuff.
Come on, Richard. Come on,
Look, look, I would taking my stuff.
Well,
I take
he's
my
taking it, he's
supplements, I
taking
take
it
my
now,
vitamin E,
and we asked for a second PSA because of
Yeah.
the Life Pack elements and all of the nutrients. And I truly believe in nutritional health, and I can tell you about that from my own experience. Yes, that's what he's taking now daily, and the fact that it's going down, that right there impressed me. It's going down, and I truly believe had I'd been more watchful and had him making sure I was counting the pills or whatever, making sure they weren't multiplying. I do believe it would have gone down a lot more, because when I discovered that we had a short window before the next PSA test, and that 1.5, we're going in the other direction, not going upward. And I mean, I'm going to piggyback on my experience with products. I'm really alive now, to the point where I'm living again, and I want Richard to live with me. When I started this journey with Dr. Omar, he called me, or no, I called him. My daughters, his nieces, begged me to call him because he is the brightest and the best, and I trust him more than any doctor out there. I mean, I right now I talk to all my doctors about my doctor. But with that being said, taking the like you said, the Cadillac or the Mercedes, I have actually taken my blood pressure from, it was running at 210 over maybe 102 down to 133 over 77. My eye pressure was 27, glaucoma suspect, as they wrote on the paper.
Yeah.
Down to, now this is only 6 weeks, mind you, 6 weeks. 6 weeks. Eye pressure has come from 27 down to 19, when the ophthalmologist told me there is absolutely nothing you can do. Just come on in next week and let me do that LASIK surgery on your eye. And I said, well, hold on. I just started a nutritional wellness lifestyle. Let's see, I got my little notes here. I was trying to stick to my notes, but I'm actually starting on my lifestyle behavior modification along with my nutrition. So I said, no, give me a little time. I want to see how that's working. And I was informed by the doctor, who was watching his watch, as he said, that would not work. I just need to get on with it and get under his laser. So I said, no, I don't want to do that. I will wait. And I gave myself, what was it, from September the 1st to October the 7th. So now I'm like 19, which I'm no longer, well, I'm in the high normal, but I'm no longer a glaucoma suspect. And I know with more time and with these products, I'm going to be a good old 12. That's my goal. Oh, let me not talk about my weight. When I started talking with Omar, Dr. Omar, I couldn't walk from here to pretty much anywhere without being out of breath. I couldn't walk one step. So now I can walk a couple miles. I can go up steps up and down. We've been building, I've been supervising a greenhouse, doing yard work, housework, and actually
Is this what you're taking, Marie? Is this what you're taking?
Yes. And with Dr. Omar, one day he called, we were talking, I told him, what have you done to me? What have you done? I'm actually working again. I mean, I'm actually providing solutions. I tell him I'm trying to, I'm just trying to hang in there now, just to hang in. And so now, my mind is clear. I truly believe that with the proper nutrition and mindset and lifestyle modification, we can reverse anything. And I mean, I might sound not realistic, but I even believe, like, I'm not even worried about, I'm really not worried about what's going on in the body, because we have help. to refresh or reset anything that, you know, we haven't let completely get out of control. So, I mean, I said it was going to be 2 minutes, but I am so happy and
Absolutely.
pleased that this meeting was here tonight, and my husband could actually come here and talk to other people going through this, and that you have tools, options to make your life better. And as far as he's talking about going to the bathroom, no, he sleeps all night long. There's no up during the night. Oh, and yeah, with me, I had edema too. So I was so swollen, and I wasn't going, you know, at all until I went to sleep at night. And you would think I had a prostate problem because I was up at 11, 11:15, 12, 12:15, blah, 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 all the time with the kidney. So now my kidney functions the way it's supposed to function, and I sleep like a person's supposed to sleep, getting rest. This is all with the help of Dr. Omar and the New Skin supplements. I use the Youth Lock, and the TR90. I'm actually at this point at 6 weeks running at a 3.2 pounds a week losing. That's where I am now. And to be honest with you, I wasn't really doing my exercise, but now I'm exercising. And it's not so much the weight, it's just that I have a new lease on life. I feel good. My body looks better. I'm not sagging. It's just everything is resetting. Everything is working well. And I know Richard is going to be well with this. But let me stop talking and let you continue.
I support what you're saying. I support what you're saying 100%. I didn't have to have my prostate removed as soon as I did. I probably wish I had got on Dave's supplements, but I will say this to you, Richard.
Yeah.
Concern if the numbers are going down, Dr. Danner's an authority on that. That's a great thing. Prostate cancer is a slow-moving cancer. Your concern with the lesions is that you don't want it to have metastasized itself to anything else outside of the pocket where the prostate actually is. So that would be something that, you know, you want to keep an eye on. I think, you know, what your wife reported about the supplements and everything is very positive, and that's a good thing. But remember something, nobody wants to live with cancer. And my doctor said to me, he said, listen, if you want to live with cancer, go live next to the power lines. My first doctor said to me, oh, you don't have to have it removed right away. You have plenty of time because it's a slow moving cancer. Well, you know, a slow moving cancer can metastasize itself, like Dr. Don is saying, into other areas. It can be enhanced by other problems within the body. So you definitely want to get a thorough and through examination. And I'll leave you with that.
Bill, let me jump in here real quick to Richard. Richard, I'm going to share something that happened. Good brother, Honorable Carlos Campbell, asked me to reach out to a friend of his who was an executive in the telecom business. I don't know if he's on the call tonight. He was invited. But this guy, brother, called me. He's in his 70s. And he said, David, I went to get my PSA and my numbers were trending upwards. I got a biopsy. They took, I think they took 20 pieces, 20 pieces from his prostate, okay? He called me and I said, listen, I've got something, the prostate formula for you, but I want you to tell me, wait until you get your results from your doctor about whether or not you had cancer or not. He had 4 lesions on his prostate. Okay, now listen to me, Richard, clearly. 4 lesions, over 20 samples they took from the biopsy. And then he was worried and he called me and I jumped in at the time and I said, wait until you get the results, call me. I'm in New York about 2 months ago on a Friday morning. He called me at 9 a.m. I woke up and he said, David, I just got my results. I said, what happened? And his name is David. He said, they did not find any cancer. Now, the doctors, though, in his initial meeting, looked at him and said, I think you have prostate cancer. You have 4 lesions. And they scared the crap out of this guy.
That's
And
what they
then-
did to you.
Exactly. It's probably what happened to Richard. But you know what, Rich? The thing is, you have to be optimistic that go through and get that biopsy. My dad had the biopsy at 87 years old. Okay. Okay. It's like Bill said, it's pressure. He's going to feel it. You feel a pinch or something. I've never had it, so I cannot give you specifics on it. But what I can tell you is what happened to this gentleman that called me months ago and told me that they believed he did. They did the test, took 20 samples, 0 cancer. He's happy. He's now on prostrate formula because he said, David, I want to be preventative, just like Bill. I want to take care of my nutrition. Let's not fool ourselves here. The baseline is Dr. Dana will back me up on this. He's the MD on this call and a professor and a biochemist in college. So this brother is who I look to for things about the vaccine, the so-called jab. When I have to go to someone to get some real medical validation, scientific, he and others, Dr. Garvin, who's not on this call, and many others, that's where I go. Because of the stuff that's on social media, you have to be careful. There's a lot of misinformation. Dr. Dana's brother works for the CDC. Okay, so this call is powerful, and I want to make sure we do more of these because obesity is another one. And Marie just told you 3-point-something pounds she's losing a week. This is TR90. We didn't even touch on that tonight.
Yeah.
Okay, and Marie told me just this week, I met her for the first time on the phone, and she said, David, I was a basket case. I had all kinds of health issues. She couldn't walk up a flight of stairs. Now she's walking a mile. Okay.
2, 3.
2, 3. What does that say? And she's got your back, Richard, because you were not on the call. She got you covered. Okay. And so, Dr. Dana, there's no accident that we're on this call tonight. And I hope, Richard, that you take for what Bill Guzman just shared with you. And Bill has shared his situation on this call. And there are others that Bill shared with about his experience. And this is how we're going to get through this, because we got the real folks here sharing real information. This is not CNN. This is not a media entity. This is real people providing real information, giving real insights. So is anybody else got a question?
Yeah, I like to share. I don't have a question. I just want to share a quick testimonial. I have had 2 biopsies. First, it was the about 12 biopsies. We talk about they take the 20 samples of a biopsy. They take samples of the tissue. Richard, I can't agree. I'm going to talk about my personal experience. The actual biopsy itself is not overly painful. It is pressure. It is uncomfortable, but it will give you peace of mind that you're going through it and you find out if you have cancer or not. I also have had the obstruction of my urinary tract where I was wearing a catheter, actual catheter on my leg for a while. And I'm not going to tell you the correction of it, the actual drugs that was used. It wasn't using the product that Dave has here. I don't want to say that won't work. This is where I was at. The urine had stopped flowing. So I had to say I have something that would work a little bit more quicker to relax the prostate and allow the urine to flow. And it worked. Again, I won't talk about the names of the drug. The doctor could I know he's familiar with them, and your doctor would be familiar with them. But it did work for me. And the exercise that I think the man Jane was talking about, where you clench your butt, they're called Kegel exercises.
Exactly.
Your family will probably know about that because they tell the women to do that when they're pregnant to practice Kegel exercise. It's just tighten up your butt, and that will give you a little bit more control. But also, when you realize that urgency comes on and it's part of your life, I don't have a problem having to go regularly or have to go time and time again. It's just that I know that bladder may start spasming. Just know where bathrooms at. Know when you possibly get up, because like he said, you could go walking around, you could be sitting there for an hour or so, but when you get up, boom, you got to go. So what you got to do is know how to adjust your life based on, okay, even though I may not have to go right now, let me just go on and do it.
Right.
And after I wore the catheter, after my urine flow had stopped flowing, that was the most painful thing, putting in the catheter. And I don't, because I went to an emergency room, they weren't as well knowledgeable about putting in a catheter. Once I went to my urologist, it was less painful. And then he gave me actual catheters that I could self-catheterize myself. And that was very easy. You take this catheter, and you put it up through the penis and it would flow right on in. This is after the medications had worked, and I was able to put the self-catheter. I use the self-catheter mainly at night if I want to say, okay, I don't want to have to get up more than 2 times. I still have to probably get up once at night, and that was just doing, no matter what, I have to get up and go to the bathroom and relieve my urine. But if I self-catheterize myself, I could probably sleep through the day. For sure, I won't get up more than once. So you got to learn how to adjust your life. And like I said, the products I believe that Dave had would help. They're more natural, but I did go the chemical route or the medication route. And that was because I had the problem of actually, I could not urinate, and they catheterized me, put me on these drugs, it relaxed the prostate. I have a normal flow. And as you get older, I know we were talking a lot about cancer. Cancer is the ultimate outcome of a possible enlarged prostate. I have a very enlarged prostate. I went through the biopsies. I don't have cancer, but most men will have, as they get older, an enlarged prostate. And these are things that we're talking about here. But I would say, I love that. I'm happy to see weak females on this call here. So you could talk to your sons, because I know I've talked to my sons. Talk to your daughters, because their husbands, their significant other will have this problem possibly in the future. And it's just something that they could be educated about and have a little less anxiety that you may be experiencing right now. So it is part of life. I think the doctor will confirm a large majority of men, as they get older, black or white, that prostate will grow. It's just whether it will grow and then turn into cancer, have cancer in it, or it will grow and cause the problem that I had, where it constricts your urine. Okay, that's enough for me.
Let me intervene on this. And, I think you make some very, very good points. And sometimes progress even to the point of obstruction, where you may have to intervene, mechanically, and put in even a catheter to decompress and put you on, like James was talking about, tamsulosin or prazosin or some of the synthetic medications. And these are to treat the symptoms associated with the condition in that state. And so, I talk about healthcare, medical care, and because modern healthcare is focused on disease or sickness, it really is a disease management system. However, your health actually depends on what you do from day to day. And what our message is that you take an ownership on it, and that there are things that you can do. So once you get it treated and stabilized, like Andre is saying, this salt palmetto, this prostate formula actually starts helping with that prostate tissue health. And this is not something that's taught in medical school. It's not something that's espoused or advocated. However, knowing actually is half the battle, and then having access to others. So once you can get to it, so I could tell you, hey, you can go to a moon, but now you don't have a rocket. You may not ever get there, but now they got SpaceX and some of these other things. It's less of, hey, this is a crazy conversation, to wait a sec, I can't afford the ticket, and they will bring that price down. So this prostate formula, these Life Pack elements, Life Pack Nano, this Age Lock Youth, actually starts helping the tissue to get healthier. And something that, like Richard was taking the Life Pack elements, Marie, Annie, she had some health conditions, including some kidney things. So, I put it on the Life Pack Nano. The difference is it's called a complete multivitamin. We think about multivitamins as essential. That's the 20 basic things you need. But a complete multivitamin actually has 20 vitamins, minerals, and what's called phytonutrients. And that helps the cells to reset, particularly with Age Lock Youth. There's something called gene expression science, and these aging clusters or anti-aging clusters. The Age Lock Youth actually affects the inflammation that causes the ends of the chromosomes to shorten and the cells to die, that leads to wrinkles and tissues and organs breaking down. There's another product called Age Lock Vitality, which actually addresses that energy cluster. but with the right nutrients and the slowing down of the aging of the cells, and then something to get rid of that inflammation and those antioxidant free radicals, getting rid of the aches and pains, it helps the body to age healthier. And so then you start doing organ specific or disease specific targeting, and things like prostate formula for prostate disease and enlargement, or cholesterol for cholesterol lowering. It actually does work against what we're thinking conventional medicine. So I would actually kind of deviate a little bit, and just, I know other people got questions, but one of the people on here, Miss McAdory, is married to Pastor McAdory, who had prostate problems for 25 years. She called me, she was feeling sluggish, post-COVID, weight gain, and just not feeling like her old self, and said, hey, tell me what I need to do. And I told her, hey, I discovered this company, New Skin and Pharmadex, and I met this guy, Dave, and he's talking about, the quality of what we take, and it's not what you take, it's what you absorb. I think I got a good solution for you. And she started using it maybe June, July, and she's 71, he's 75, and she could tell her story, because I think it's just as powerful. So I'm going to just turn it over to her, and then we can ask more questions. But
Hey, Dorothy.
Hey, Dorothy. You come off mute. It works a little better off mute.
You're on mute.
I was trying to stay quiet tonight. Gee whiz.
You got to share your story. You got to share your story, please.
Okay, look, I have so many that I've been involved with you all. I tell you, I've done the age lock youth, and do y'all see my youth here? This is called Pink Hair Tonight, okay? And now who's 71? Do you know we'll put on some pink hair, okay? But I feel great, and that's the number one thing. I had gone through COVID, and I was feeling sluggish, had eaten too much, and just nothing was going right. And I'm like, hey, this is not me. What did I do? I called my friend. Hey, listen, what you got? I know David Terri. Let me tell you what they got. And listen, I said, sign me up, okay? And I got my age lock youth, and started taking that and my nano, and listening, and when I started and I found out about the prostate supplements, and I said, hey, give me some of that for my husband, right? That's because he's going to the bathroom too much, okay? And he started taking that, and I'm telling you, he don't run over me anymore, okay? Getting to the bathroom. So, life is real, guys, okay? And as women, we need to respect and love our husband enough to love him to behavioral change. It's like, you can do this and make a difference in your life, okay? So I can't say enough about my vitality, the way I feel, the things I do, and sometimes at the end of the day, I'm going like, okay, you might need to slow down a little bit, but I try to get that 7 to 9 hours of sleep, get up and start all over again.
Yep. Awesome, Dorothy. And
if you haven't tried it, try.
Yeah, but the fact that, your husband is also, you got him in mind and taking care of him, just like Marie with Richard, and, Terry with me, and it's a partnership. And I think for those single folks that are on, your boyfriend, or your girlfriend is understanding that Dr. Dana always told me, he said, David, I'm a surgeon. I'm John Hopkins trained. I've been to the best, and I've learned all this information, but he says, the bottom line is you got to get your nutrition right first. Cut through the chase. If you don't have that right, you're starting from a baseline of difficulty. You need to be at the base, taking care of nutrition, eating right, the habits that Marie talked about before she recognized that, what she needs to eat, and to eat right, the right kind of veggies, the green vegetables, the vegetables with great polyphenols, and the carotenoids that are your bell peppers that are bright in color. Those are powerful for you. And spinach and collard greens and kale, load up on those because they have the polyphenols. And then your green tea, drink some green tea instead of the coffee, because the coffee is a stimulant. They told me this in 1974 in college, a stimulant, right? Get off the stimulants because it's not helping you. Your heart has been working for 40 years, and you need to understand that you spike that heart with more stimulation. It's just getting the body revved up. Don't do that to your body. Do it naturally. Botanicals, these are things, when I asked the scientists, am I putting anything in my body that was concocted in a lab? They said, David and Terry, no. Everything we have has been found in nature for centuries, but we just now have the tools to validate through the heat map and the spectrometers and all the equipment that they show us that they use to validate what's good for the body. And as Dr. Dana said, Richard, your healthy cells in your prostate, you start there. I don't know where the chips may fall later, but if you start with good nutrition and habits, and Dr. Dana will tell you, I don't want to do surgery on you. He's turned away people from bariatric surgery. Why? You want me to tie my stomach to trick the body into eating food? No. Go back and take your nutrition and come back and see me. If you truly have a problem and you still want that surgery to tie up your small intestines, then I will do the job because that's what you pay me to do. And that's what you want me to do. But Dr. Dana is not one of those guys that are looking at his watch bill. He doesn't do that. He says, he's a spiritual guy. He's about the truth in medicine, in Western medicine. He's about the truth and understanding traditional Chinese medicine that's been around for centuries. And so we all have to go back to the core and the basics of your nutrition. Don't get it twisted. And you got to walk like Maria's doing. Maria's doing 1 mile or 2 miles. Guess what? She could barely walk up a flight of stairs. And she was truly, when she told me she was going down a slippery slope with her health, and she turned it around because she listened to Dr. Dana, a person she trusts. And it's no accident that Terry and I met Dr. Dana. You hear me? I'm putting it out there on public call today. This guy is God sent. Okay, and he's very humble and he tries to play it down. But I'm telling you, this is not something that I run into him on a call with about 60 brothers. And thanks to James Smith and Stan Campbell, I met this brother and it's changed my perspective, or I should say, improve upon my perspective and what I've learned. And I brought him to the promised land to meet the company and the executives and the scientists. And I want to take all of you out there with us and Dr. Dana. I want to take you there. You need to come see it for yourself. You become believers. Marie, Dorothy, you're believers, you understand. But until you go see it for yourself and touch it, you then become a different believer like Terry and I and Dr. Dana, Dr. Al Garvin, the nuclear cardiologist out of Modesto, California. Jim Brown, I'm just going to share this story. Jim Brown had a problem, and I got a phone call yesterday about Jim Brown. You know, the celebrity Jim Brown. His wife, Monique, contacted Carlos Campbell, who contacted me. David, we need help. Jim has got some issues. Dr. Dana, who you know in California.
It's crazy.
Dr. Al Garvin, our frat brother Bill, was plugged in. He texted me today, he said, Dixon, I'll have an answer for Monique in a couple of days because Bill needs some medical attention right now in LA. Now, Dr. Garvin turned him on and said, I've got it. I'm listening to the issues that Jim Brown is having, both maybe some arthritic issues, but some balancing issues and some Parkinson's type issues going on. And Carlos and Jim Brown are close friends for over 45 years. They acted together, you know, when Carlos was in LA after he stepped off from being Commerce Secretary under Ronald Reagan. So Carlos is here, 82, and one of our business partners. But this is powerful that, you know, we're getting calls like that to say, we need your assistance and help with some medical professionals in our community that, like Dr. Dana, Dr. James Roberts, who sits in, who's probably not on the call tonight, another frat brother of Rory's and mine and Bill, that is a cardiologist in Charlotte, North Carolina. But there's a lot of folks that embrace the natural health that Dr. Dana embraces as a rare physician. He's not pushing drugs and he's not pushing the scalpel. He will use it if he needs to. And if you're in the emergency room and you're going to die, he's going to try to save your life. That's what he does.
And just one point I want to make, and I want to ask Dorothy one question. I guess, Shock, I know that other people got questions. And that is that, you know, what Dave is saying is very important. New Skin, Solid Corporation, they're a very professional organization, invested a lot of money in doing things right. So the success is a purification process. It's just top line, it's pharmaceutical grade, and they're vertically integrated. So nothing leaves there, it goes to a different distributor. So it's not cut, it's not thin. And so you get pure products delivered by people who go around the world to basically find it, source it, and then develop it and put the best quality of products in there, which was probably the most impressive things, their state-of-the-art equipment. And at the end of the day, the thing that I like more than anything else is that they're very personable. They care about us. It's a direct sale. So basically, by eliminating the middleman, there's a saying in America and in Western society, you get what you pay for. It costs more, but you get more. So when you dilute out like CBD oil, you have to understand it's only 3% by the time it gets to the end user. So it doesn't work. Quality, quantity, purity, and absorption all matter. So we need to start thinking about nutrition science as we think about our health. And I just want to give that little biopsy or commentary. But Dorothy, what I wanted to ask was, just for the perspective, a lot of men's on this is talking about prostate. How long did Pastor McAdory have a problem with prostate issues before he started this in this transition?
Well, they don't tell you everything when it happens and when it starts, okay? You just kind of have to figure it out for yourself. You have to notice these behaviors, okay? And so I say he's been doing that for doing something with Saul Palmetto for at least 25 years, for at least that long.
Wow.
25 years of having prostate. And he said, I used to, he literally gave me one day and just gave his own testimonial that I used to almost knock it down from coming from running and coming in the house. First thing I did, beeline to the bathroom. He said, now I don't have to do that. I could do me and then show up and everything is under control. I don't get up in the middle of the night. And I'm like, wow, you just hope for a little improvement, but it's really dramatic and it really does work. And these are independent validations, not that we did it as a test or anything, but it's like, okay, this makes sense. Because, you hear about Saul Palmetto and these other things, but the guys at New Skin, they're scientists, they're ethnobotanists, they're pharmacists, and they're paid by New Skin, which is a $3 billion publicly traded New York Stock Exchange top 1,000 company. On the stock ticker is NUS. They were profitable during the pandemic. But they have over 100 scientists working under a chief scientist, Dr. Joe Chang, who is, a world-renowned scientist. And they work together as opposed to, Dr. Danner is an expert in heart, expert in prostate, expert in obesity, expert in, neurosurgery. At some point, Shaka, you gotta have a limp, but they have scientists, nutritionists, doctors working together, and 100 of them that's paid by this corporation to deliver the best products in the world. And, again, as a person growing up in allopathic medicine and synthetic medicine, they just, and a surgeon at that, this is totally against the grain of where I'm trained. But, if you notice, if people drive Cadillacs and Mercedes and BMWs, people who have good cars, a good car when you see it. And so this is a good product. And these testimonials are independent, they're not coerced. They're just information, feedback that everybody's sharing naturally. So I just wanted to put that out there. But Shaka,
let me say, Dr. Danner, let me say that when I got the order when I received the order for when it came for the prostate my husband started taking that, and within 10 days, he had a noticeable difference, okay? And it was like, hey, I'm not going to the bathroom as much. Listen, now he gives me time to go in the bathroom and come out. It's like, who wants to go in first? He says, no, you go. I'll wait. I'm like, really? So I'm telling you, the product is pure and it works. It absorbs in the system and it works, okay? I just, and I'm telling you as a witness, it works.
So to add to that, Dorothy, let me just share with you guys as
you want me to bring mine out? I got mine in the kitchen. You
I know
want
you got yours. I know you. No, but this
Hey,
absorption.
I just want to let you know the Red Sox are winning 9-0. You guys have a good night. Ladies
All right,
and
Bill,
gentlemen,
thanks for sharing, man. Yeah, you Red Sox fan. How's the Yankees doing?
they're sitting on the bench like everybody else.
So,
Okay, I'll take
all right,
that
Bill.
stab. I'll take that stab.
I know.
Man.
Hey, I know. Hey, Andre, yeah, we'll take that stab. It's all right. We'll get Bill. But this is 85% absorption in the body. And there's a reason. It tells you on the box why the absorption happens, because it's scientific nanotechnology. It's not about what you eat, it's what you absorb. If you eat stuff and don't absorb it, if you take those horse-looking tablets that are considered vitamins that you can hit somebody in the head like a rock, you're not going to get but maybe 5 or 10% out of it if you're lucky. You're going to make expensive urine. This does not make you expensive urine. When I first started this, I went to the toilet and I looked, because one of the doctors told me out there, look at your urine after you take this. You will not see that high yellow, because I'm not making expensive urine that's going in the toilet. 85% absorption of the minerals are wrapped. A piece of ore, there's no iron in here, but the previous supplement they had at iron, and they had to wrap it with what is called amino acids, which is chelation with a C. That's the only way you get a piece of ore or metal in a woman's body that needs a menstrual cycle every month to give her what she needs. Most Black folks are anemic. You need iron. So we have one called ferrous. It's not from a piece of ore or metal. It's botanical. And again, that iron is a chewable. You just put it on your counter, chew it once a day. My dad and my mom are 94 and 90, and they take that every day to get them iron. Okay, so there is chewable iron, there's chewable D3, there's chewable zinc and vitamin C, ester C, which is the most powerful vitamin C ascorbic acid out there. High quality, again, as Dr. Dana said, they don't cut any corners. And this is what everybody's getting that energy from. Marie, Dorothy, and many others on this call. Rory has been on this call, on this product, its predecessor product, for Rory, how many years? Over 25 years?
Even longer.
And he had a brain aneurysm 30 years ago and survived it. He might have had this in his system, and the doctors looked at Rory when I got to Richmond in the hospital. The day I went to see him, he was on a golf course, had a brain aneurysm, took him to the Richmond hospital. The doctor said, I was perplexed. Why did the vessel just clog up, and never had to do brain surgery on Rory?
We don't know.
He and I believe that this could have saved his life, because the vessels, it coagulate, it clogged after the capillary broke in his brain. I watched them drain fluid from Rory's head that was pink, reddish color until it become clear as embryonic fluid, which looks like water. And Rory was having headaches until that. The brain doesn't like blood, and Dr. Daniel will tell you that. Doesn't like blood, although it's in your body. So Rory, I was there, and Rory bled, and then it cleared up, and it clogged. And the doctor said, how did this happen? He was checked out of the hospital, and here he is today, 30 years later.
So,
Can I say?
Go ahead, Rory.
No, it's you know, it's truly a miracle. You know, the doctors can't explain it. So I truly believe that the supplements had something to do with it. I can't be for certain, but I'm willing to bet any amount of money on it.
When you give the cells what they need, they can rebuild in a healthy fashion. And this is what, you know, this whole concept is about. As a bariatric surgeon, it ain't just basically cutting the stomach off. You have to put the right nutrition in. The cells are programmed to turn over, but as they're turning over, they have to rebuild. So when you put the right substrate in, the body says, body heal thyself, physician heal thyself. It's actually the way it's programmed. The reason our life expectancy is shortened is because we put the wrong stuff in, processed stuff in, too much of the wrong, not enough of the right. And that's why we get these chronic diseases, these modern chronic metabolic diseases. And that's the take home message. It is fixable. It isn't magic. It's just the nutrition. It's just the way the body is designed. And that's why the Bible says, so as you sow, so shall you reap. If you sow the right stuff to the flesh and to the body, you'll actually reap of that the right things. You'll be healthier. Most of the reasons that we are sick is because of Western lifestyle related things. Some things, if you look at the things that cause disease, there are 4 major things that cause chronic metabolic disease. 1 is environment, 2, genetics, 3, access to care, and the 4th one is lifestyle. Of those, modifiable lifestyle related choices cause 50% of the reasons that we have disease. Environment causes 20 and access to care 10, meaning only 20% is genetic, and the genetic, even somebody has a high cholesterol risk, is actually influenceable with proper nutrition, but it takes a mindset change. And that's why, one of my favorite scriptures in the Bible says, our people are destroyed for a lack of knowledge. That's why education is so important. That's why we're spending so much time that, hey, here, take this medical information. When I was in medical school, the first few days, I'm like, you taught them what you're teaching us. Actually, people in society be a lot better off. But what they do is they educate us, and we sell you a little bit of knowledge for a little bit of money. And that's the way the healthcare industrial complex works. But to take care of yourself, you have to be empowered, because it's hard to coach somebody and counsel them if they don't have the right educational foundation. And once you get that, you got to have the right tools, the right access to the right resources. So it's not just a proper diet. That's like paying rent. If you get behind on, you have to supplement on top of it to play catch up. But the take home message, Walter, is that you can do something about it. But the most important investment that you can make at this stage in life is the one that you make in yourself. And that's what I would say that is my final comment. So what I'd like to do is anybody else will go around the people who haven't said anything, and maybe if they have anything they want to say, we'll give you the chance. And then we're going to close off, because we want to thank you for being on this long. I know it's been a marathon, but hopefully it's been very informative, and everybody's learned a lot from you guys. So I appreciate everybody who's chimed in to really make this is real. This is the talk that we need to be having as an international body of people. This is about humanity, and we should have these kind of dialogues and not kind of operate in these silos.
Yeah,
One last thing, Dr. Danner, and Dave, one last thing is this. You all know my favorite thing is my morning G3 drink, okay?
Yes.
My husband gives it to me religiously. And I've been drinking it out of the 2-ounce dollar store cup. I think now it's time for him to get me something crystal and let me have a 2-ounce crystal digger, because it works so well. Thank you.
Thank you.
Thank you. Anybody else got anything they want to share or say, and then we're gonna close out? Thanks, Andre, for your comments and your contribution too.
Hey,
Shaka,
Travis is down in Jamaica. He's still on. Travis, my cousin. Good deal, man. Appreciate it.
Shaka, anything you want to say? You're on mute. You're on mute still.
I'm muted.
Okay, now we can hear you.
There I go. Okay. It's been interesting. I was on the last time with you guys talking about the vaccines. I mentioned the fact that for the last 32 years, I'm a vegan, and I haven't eaten meat, touched meat in 32 years. And I haven't had any health problems. I'm 65 years old. So, that is, I agree with everything you say in terms of health and nutrition. I will fight with that weapon any day over any drug or any chemical. That's always been my position. And so that is something, I have a slightly different routine, David. I don't use your product, but I have a slightly different routine each day that I use to maintain health and vitality. So anyway, I've enjoyed this, and thank you so much.
Thanks, Shaka. Appreciate it. Anyone else? And we'll be having more seminars, so stay tuned as Dr. Daner, we talk about, maybe obesity as one. It's an epidemic around the world, and there are a lot of people coming out of the pandemic that picked up extra weight. They just don't know how to get rid of it, because if you trick the body, you're gonna pick up more weight. When you think you're losing, you're gonna pick up more. So with TR90, we need to do a seminar on TR90 to really talk about why it's so powerful, why you don't have the cravings for junk food when you're on the supplements, because it's taking care of you on a 360 degree basis. And it's not just tricking the body. It's a natural process that has been validated with science and clinical studies.
And so just to add to that, just when you talk about obesity, you have to think about the central metabolic syndrome. That's that pre-diabetes, hypertension, high cholesterol, and weight gain. And so when you think about weight gain and obesity, you have to think about calorie gain and nutrition loss. So the reason people are having bad outcomes throughout the pandemic is actually due to these micronutrient hidden nutritional deficiencies that people aren't talking about. And so we have to start understanding that as we look at chronic disease, that when you start replenishing them, these diseases that we call diabetes and pre-diabetes and hypertension actually start to go away. So you need to have a high quality premium product, whether, you know, the name brand New Skin versus something else doesn't actually mean anything. It's the quality. And so you got to understand that actually there's not regulation out there. These are not FDA regulated. So having companies like a New Skin and a Pharmanex that does this for us, there are other ones as well, that basically gives you what you need to replenish the nutritional system while you're doing this. So it's a you know, interesting and fantastic discussion that we'll have when we talk about nutrition and obesity and this metabolic syndrome, but not just weight gain, because it makes it too simple. We want to get deeper into it and understand it as it relates to how it affects our health. So I look forward to it. I'm going to let everybody get off. And so, you know, again, to God be the glory. You know, I thank him for the medical education and training. Thank you for my friends, family, and colleagues. And I think you guys have been wonderful troopers. And hopefully everybody learned just one or two things that they could take away and use, whether it's for themselves or their loved one. So we appreciate everybody who had the chance to stick it up and those who didn't just as much. And if you need anything, feel free to reach out to me. Feel free to reach out to Dave, and we'll assist in any way we can. Okay?
Yes.
So
Thank you.
Thanks, Doc. Thanks, Dave.
Thank you, Doc.
Appreciate you guys.
Good night.
Welcome.
Appreciate you guys. Good night,
Thank you
people.
all so much. Good night.
Last night.
Good
night.
Thank you very much.
Good night.
Boston sucks.
Hi, Denise.
Hey, Burge.
Yeah,
Yeah, Bill jumped off, Burge. He jumped
I know.
off. Bill is an avid Red Sox fan, but he doesn't know.
I imagine.
what guy.
I thought you might lean that way also after going to school up there.
No, bro.
Okay.
New York all the way.
All right.
Thanks,
That's the way it
Peter.
is. I'm out here in California and I'm still that way. Will always be.
Oh, yeah, I know. You're not switching even though you're in California.
That's for sure.
But thanks again for joining, everybody. Dr. Dana, thank you, man.
Bye-bye now.
Appreciate it. All right.
Bye-bye now. All right, thanks. Bye-bye.